Carol, as you know, is Executive Director of WellMed's Charitable Foundation, and she holds a master's degree in social gerontology, has been involved in the field of aging for more than 20 years. She is chair of the board of directors, new position for her, for the National Council on Aging. Her background includes work at the 1995 White House Conference on Aging. She must have been a student intern there. The American Association of Homes and Services, chair of the National Institute of Community-Based Long-Term Care, and a board member of the National Association of Area Agencies on Agencies, known affectionately as AAAs. She currently serves as the Vice President of Community Relations for WellMed Medical Management, and she earned and received the 2008 Outstanding Professional in Aging Award in Texas for contributions to the field of aging. And I tell her every week when we do our one-hour radio show that she has forgotten more about this field than I will ever know. And I know many of you who know Carol are aware of her incredible depth of knowledge and experience with aging. So please welcome Carol Zernial.
I wasn't planning on being red, white, and blue when I got up here. Thank you for that gushing introduction, Ron. It is my pleasure on behalf of George Rapier, who's the chairman of the board of the WellMed Charitable Foundation, to welcome you to our 2014 Caregiver Summit. And this is a community service for everyone. You know, we wanted everything at no cost. We wanted everyone to come, and we're so pleased that you did. That the big smile on my face is because you did come. The rain stopped long enough for you able to drive through the streets. I didn't think I'd say that. You know, that I was thankful that it wasn't raining, but it wasn't, and we're pleased to have a wonderful day here. And I want to also recognize NOWCastSA, who is live streaming these presentations this morning, and they'll also be loaded on our website. So NOWCastSA helps connect the community to important events. I'm waving at the camera and waving at you back there, NOWCast. So thank you for joining us. So be sure and, you know, look good the whole time you're here. You never know where the camera is. Actually, I think the camera is pointed this way and you're safe. But we're very pleased to be streaming, and we send greetings. Besides the professionals and the family caregivers we have in the audience, we send our greetings to everybody that is looking at this on NOWCast and on the website. So good morning and good afternoon and good evening whenever you're watching it. What I would really like to do today is tell you a little bit about the WellMed Charitable Foundation and a little more about our work in caregiver services, because I don't think everybody does know exactly the services that we do provide in the community. Our foundation was started in 2006 by Dr. George Rapier, who's the CEO of WellMed Medical Management, who founded WellMed, and he wanted to give back to the community. And he's a very wise man and a very generous man, and he recognized that the family caregiver is an integral part of the care team, that family caregivers need to be involved in the conversations, they need support, and it's impossible for the clinics to give them the additional support that they need so that they can provide the best care and also care for themselves. So we got into the caregiver business through his vision. The WellMed Charitable Foundation gives away about $500,000 a year to the communities where WellMed provides services. So we're the philanthropic partner. We're an independent 501c3, but where do we get our money? Well, it's kind of cool because all of the WellMed doctors and nurses and staff donate money, $10, $20 out of their paycheck every week so that we can provide caregiver services in the community, which is very, very cool. And we raise several $100,000 just from our employees donating to our program. And I want to thank the WellMed employees who are here for those checks. We'll take those. You know, we're very proud to operate senior centers across Texas. We operate 2 of the largest senior centers in San Antonio. The Elvira Cisneros Center on the southwest side of town is exclusively run by WellMed. And then we partner with the city of San Antonio for the Lisa Trevino Lopez Center, and that's off Culebra. We're going to be opening a new senior center in District 7. It'll open in December and grand opening in January by Ingram Park Mall, also in partnership with the City of San Antonio. I see Victor Ayala in the audience. Wave, Victor. Victor is going to be working at the new District 7 Senior Center with us. We're pleased to have that partnership. Our senior centers, we also have senior centers in the Lower Rio Grande Valley and in Austin. We serve about 17,000 seniors through our senior centers, which is a lot of fun. We love the senior centers. But the other core service that we do is caregiver services. And you see Caregiver SOS all over the tables. Hopefully you've seen our staff in the back. And the yellow bags around the tables have information about the programs that I'm going to talk about. We actually run 5 caregiver resource centers in Texas, 2 in San Antonio, 1 in Corpus Christi, and 2 in the Lower Rio Grande Valley. And I would like my 2 caregiver program managers for San Antonio to stand up because I saw Gloria just sink and she disappeared from view. So Gloria Miranda and Joy McQueen are the folks here in San Antonio that you want to get to know. Joy is at Northern Hills starting in January, and Gloria is at the Cisneros Center on the south side of town. Also, she's already there. We're moving some people around. And then is Debbie Billa still? Oh, Debbie's in the room too. Debbie Billa runs our caregiver programs. Thank you, Debbie, for putting all this together today. And the 2 programs besides the Caregiver Resource Centers, so our resource centers are walk-in centers or call-up centers where caregivers can get wellness, information, support, and education. So, we try to know about the resources. We provide support groups. We provide access to exercise and information and all those things that make caregivers' journeys a little bit easier. But for those that can't come to our centers, we operate the Caregiver Teleconnection. And I hope at least, how many in the room have used the Caregiver Teleconnection? If you... Good. I'm glad to see that. It's a telephone-based program because what could be easier than the telephone? You're completely anonymous. You can have your hair sticking up, wearing an old bathrobe and chewing on something, and no one knows that. They don't know who you are. And you get to talk to professionals, lawyers, doctors, social workers, people that are experts and have information valuable to caregivers, and then the caregivers also get to talk to other caregivers on the phone. So we have some socialization. There's a calendar in your bag. We have a new series every month that we offer different sessions, and it's available throughout the state of Texas, and actually we have people call in from all over the country for our Caregiver Teleconnection. You can also get the schedule in our e-newsletter. I want to mention Sue Ellen Lewis. She's not here today, but she does our e-blast and provides lots of information about the teleconnection, the SOS centers. If you'd like to be on that e-blast, please sign up at the registration desk. I want to ask Minerva to stand up. She coordinates the Caregiver Teleconnection. Minerva is the friendly voice on the phone. Thank you, Minerva. And the other program I want to mention, I know we've got partners in the room, is our stress busting program for family caregivers of persons with Alzheimer's and related dementias. So this is an evidence-based program. It means it's grounded in science. It was developed right here by Dr. Sharon Lewis at the UT Health Science Center, and it is proven to reduce stress, reduce anxiety, reduce anger, and improve quality of life. And I don't know any of us that wouldn't like all of those things to happen. That's especially important if you're caring for someone that has Alzheimer's. So if you're a professional in the room and you're interested in delivering a program that can help manage stress, our caregivers actually learn techniques to reduce their stress. They learn to practice them and pick which ones work for them. Or if you're a caregiver and you haven't gone through the stress busting program and you're caring for someone with Alzheimer's, please call Minerva, the friendly voice on the phone, and she can tell you when our classes are. All of our information, as Ron mentioned, is on the web at www.caregiversos.org. And so that's kind of the nuts and bolts of our caregiver services. We want you to call, we want you to take advantage of them, and we want you to partner with us. But that brings me to today in our Caregiver Summit. I think you heard Ron mention that we do Caregiver SOS on air, our radio show, and we met our keynote speaker just on the radio show this past year, and Dr. Sid O'Brien. We've been doing this for 3 years, and some of the topics we deal with are tough. And the diseases we talk about and the conditions of the caregivers. And, I've been in the field for 20 years, and sometimes Ron and I will walk away from the studio and our faces are long and our hearts are heavy for what everyone has to go through. But Dr. Sid O'Brien is the first person that made me smile talking about Alzheimer's disease. He's the first person that actually gave me hope about the future and where research is going in Alzheimer's disease. You know, he won a national award, and after talking to him, we said, no wonder you won this award. You know, he just has a whole different way of thinking about it. And we're so excited that he agreed to come down here today. He's flying down this morning, so you'll meet him in a little while. But very excited for him to share the information, and I hope that you're going to walk away with a smile on your face as well. We're fortunate to have Dr. Oakes, our own Dr. Oakes from WellMed, who's with palliative care. You know, and palliative care is something, I hear about it all the time. I never heard about it. I hear about it all of the time. It's a growing field. It's an important field. It's not hospice, but it's where medicine is going, and Dr. Oakes is one of the best. So we're thrilled to have her. And Dr. Arevalo Fleches, I don't know, I haven't had the privilege of talking with her before, but she must know everybody in this room, or at least half the people, because wherever I mention her name, they talk about her expertise, they talk about how wonderful she is, so we're thrilled to have her as well. But the most important thing that I want to say today is that we've come together, you know, as a family of caregivers and professional caregivers, and it's important for us to come together and to learn new things. But it's even more important to step away every once in a while from the everyday that we do on and on and on, and sit shoulder to shoulder with each other, and for other people to see us, and we're doing something for ourselves. So I want to encourage all of you at the tables today to look around you, introduce yourselves to the people at your table if you don't know them, squeeze their hand, pat their shoulder. You know, all of us do the best that we can every day, and it's important for us to be recognized and for people to see us, and to allow us to have this day for ourselves. This day is for you. Thank you for coming, and welcome to the Caregiver Summit.